The discussion here has to do with the options for penile implant surgery, the malleable device, the semi-rigid malleable device, as well as the hydraulic inflatable device. I think both are valid options, and it's good to be able to bring forward to patients our field now in modern times of urology, these options that can be brought to all patients, these for discussion, and then review what their goals are, review what are the potential benefits and risks of the different options. That's how medicine should be done in an honorable way. So I do think that having these options are something that allows us, implant surgeons, to counsel patients that we can bring these options to them and help them consider whether this is appropriate for them if they've been properly informed about these options. The two main types of devices, as mentioned, then are the semi-rigid malleable devices, the hydraulic inflatable. Certainly the semi-rigid malleable device is somewhat less complicated to insert surgically, but for a surgeon who is involved in implant surgery may learn also to do the more involved sort of surgical technique of the inflatable device and accomplish that goal for the patient. The inflatable devices have some potential advantages that I see compared to the semi-rigid malleable devices. The inflatable devices are devices that look more natural when they are erect and look more natural when they are deflated. So in the inflation mode, they more likely resemble the natural erect penis in terms of size and rigidity compared to the malleable devices. And then when they are not in use and the device is brought down, it's much more concealable and natural looking than the semi-rigid malleable device tends to be. So I think there are some potential advantages for a patient who, upon hearing about what the merits of the inflatable device would be and what it could offer to them, that if they're attracted to this option, it's great to be able to bring that to that patient who wants to have this kind of objective. Now, in terms of using the device, the inflatable device does require some knowledge by the patient of how to properly inflate and deflate the device. So it's a little more involved in terms of their understanding, but I think patients can be taught how to use these devices and have a very successful use of these devices.